As part of your Saturday, my name is Theophilus Ilaman. Of course, I am here with my able assistant, able sidekick, Debanke Oduni. Thank you very much for staying with us and joining us at this point.
Thank you very much.
All right, she will always be with me from now henceforth. Of course, we also are going to be talking about the movie industry, and the person you saw in that gyration video is right here in the studio, the president, the national president of the Actors Guild of Nigeria, Emeka Rollas, AGN. Thank you very much for coming.
Thank you. Thank you.
Okay, so let's go straight to the point now. We're talking about the welfare of actors, the welfare of individuals in the film industry in Nigeria. Of course, with one particular case is that of Mr. Ibu, recent case. We've heard from Kate Henshaw, of course, speaking on behalf of the AGN. What's your take?
Well, it depends on the angle you want my take. We have structures that have been put in place for all actors to benefit. First of all, we have an insurance scheme that comes with your registration and then your annual dues. And then secondly, we have the health scheme. We have over 600 hospitals that we are signed on to. Every actor has the opportunity to sign on to this HMO. And you know, HMO is an annual payment. But I find out that most people, which is the Nigerian system, they have empathy for anything payment, from tax to... So you see people, when they need a job, they quickly make payments. Then after 1 year it expires, it becomes difficult for them to come on. But added to that, we still also have the trust fund. The trust fund is managed by Joke Silva. The trust fund is a trust fund we created for those who really want to help actors to put in money there, so that when we have this kind of cases like Mr. Ebu, we simply go there to draw funds from. But sometimes, because some actors, in quote, enjoy this public begging, yes, they enjoy it because you don't know how much, you cannot moderate how much is given to that actor. Sometimes they get well over millions and you don't know how they spend it. And after a short time, they return back to social media again, asking for the same fund. You are aware of some cases where most of my members have been ridiculed, even by men of God, come out publicly to donate, huge sum of money, claiming that they want to treat them. You cannot treat somebody you don't know his ailment. Then after giving somebody 20 million naira, whereas the person needs 50 million naira, you have not solved that problem. Then all of those people that they have given these monies, can you find out their state of health today? They are still suffering either the same ailment or another ailment put together. So we are trying our best to see that you don't allow members rush to social media, cap in hands, begging. These facilities are there. If you love Nollywood or if you love actors and you are outside us, ask us, how do we deal with these kind of conditions? There are a lot of people out there who are sick.
But what did you do for Mr. Ibu? We want to hear from you. What did the AGN do for Mr. Ibu?
Now, AGN, for Ibu's case, it's been over 2 years. This is the first time I'm speaking on media after the director of communication has spoken about it. Now, remember this. Ibu's case has been there for 2 years and it's recurrent. I will not, if you call Ned Nwoko is the chairman of AGN Patrons Board. He kept Ibu in the Turkish hospital in Abuja for over a month. I don't know how much he spent, but you know what it means, keeping someone at Turkish hospital. What kind of assistance do you need from the guild, if not things like this? After he stayed there for 1 month, at one point, he was abandoned, I don't know whether by the family, at one Zenith hospital in Abuja. AGN came to the rescue. I paid the bills. I had Mirabelle Took used to be my SA. I sent her to remain in the hospital with Mr. Ebu, pay all of these funds that needed at Zenith Hospital, and again. And then when this issue came up, they just sent me an SMS message telling me, and we run in departments. And what are these departments? I cannot control all the actors in just one bit. Even while his case was on, there are some other cases who are on. We called some of our patrons and said, okay, it appears this Ibu's case has reoccurred again. Please, at this point, AGN, we have, of course, how do I use it? We have exhausted all our normal constitutional provision for this actor. Having spent this on him, having sent him to hospital through our patron, I think what we need to do now is to see how we can rally around ourselves or some of our patrons to send money to his account directly. I had a series of meetings. And then the next thing is, boom, on social media. And within that period they were mentioning, I have on record some of our patrons who were already sending money to their account, letting me know that this is what we're doing, not knowing that they didn't keep him in the right hospital, they didn't really do much for him. And then you come to blame Actors Guild of Nigeria. AGN is not a next of kin to any actor.
Okay, well, I wonder why, because there was a video on social media making rounds that the wife was saying that the AGN has not done anything. Yeah. Why do you think that was even done? Why do you think she said that and put it on social media?
I think she must have been ill-advised, because if I remember, if I open my phone, when I just mentioned that Ibu was abandoned at Zenith Hospital, when we brought him out of Zenith Hospital, I was in the same hotel with him for 5 good days. Within those 5 days, the wife was calling me morning, night. Do you understand? And if you had gotten to that point with the president of the guild, I wonder why I rushed to social media to start to torment people who are actually helping your husband.
So right now, what's now the way forward in his case?
The way forward in his case is not something I will have to begin to mention here. But first, he's received support from Nigerians. Even while all this were going on, I have gotten funds for him from 2 presidential aspirants. I wouldn't want to mention names.
Okay, that's fine.
And I told them, send money direct to the account. I've spoken to a wife of a governor. She sent money. The problem we're having here is that we cannot moderate these funds, and we don't know what these funds are used for, but it's for the family. But at this point, when you have gotten to that level, you do no longer depend on the guild to hear what is next. It depends on that family and his wife, because already a lot of Nigerians have assisted, both from within the country and outside the country. So it's no longer on us. We are dealing with other issues who have not received attention.
So what is the, you mentioned that your anger as regards public begging. What is the guild doing to stop that trend? Because we still see it happening in the industry.
Like I explained, if you are sick and you are part of the guild, we have 3 channels. First of all, like presently, we've been handling another case, a big actor in the last 1 year. Okay. At least he has not come to beg anybody, publicly. But we have followed his case through. On one occasion in Port Harcourt, I had to send National State Task Force to go make sure that on that set, he was properly taken care of. Because it was the same thing that happened to Don Brimo. Don Brimo died on set. One, Don Brimo is not on the HMO, so he doesn't even know his health status. So when he arrived at the location and they saw how he was looking, an actor told the producer, we will not allow this man go on set until he's taken to the hospital. And the producer refused. And that same night, he slumped. So if he were on the HMO, at least he would have known his health status at that point. So it's important for actors. How much is it? It's about 1,600 naira per month and about 20-something thousand per annum. At least you have a hospital to yourself. You know your heart rate, you know all of those things before it degenerates to a point where you're now needing people to assist you. And of course, as an actor, you must be able to build relationship either among actors, among other people. For crying out loud, what has led to Mr. Ibu's shout to social media was very simple. You had arthritis, and then you left your foot for local acupuncturist to cut your body.
Wow.
And it began to decay at that point. It's not even something that needed that quick response where shouting to people. Because the original matter you were handling on your body was you had a heart issue. Your heart was not performing normally, optimally. And then that's what doctors have been dealing with. And then just last month or thereabout, you had a show in Abuja. people came together, you had a birthday show.
Yeah,
and
concerts.
So a concert. After that concert, you hardly didn't have money again to deal with something of that nature. It's ridiculous. You understand the point? And then when you left your leg for local acupuncturists to begin to handle, you are mixing two different authorities, and now it's affecting you. If you're part of the HMO, all of these times money were being raised for you, you ought to have registered with these HMOs. Be part of the guild structure of health benefits for the association.
But I mean, I would like to ask, is there a way you can make these actors that you help, maybe with their health and health issues, is there a way for you to make them sign an agreement of sorts that they should not go on social media to ask for money? Because, I mean, when Mr. Ibu posted the video and when his wife posted another video, there was a lot of backlash from social media tweets saying that the actors were not, actors in Nigeria are not taken care of.
You know, when I get to that extreme of someone having to sign for me, I ask myself, what am I trying to achieve? Trying to defend the guild before social media people? That's not people we're working for. That's why I haven't really made any comment about it. But we know what we have done. Okay. I'm sure that on the news last year, you saw when Mona Lisa Chinda was the director of communications. I'm sure you saw also the video of when Mona Lisa went to the hospital. She went there to represent me because I wasn't in Abuja at that point. So videos shows what we have done. You know, so for anybody to come on social media to start to troll the AGN, those are not things to worry me. I don't think those should worry me, actually. I should focus on what we're doing. You must know that the decadence of the guild, having had long leadership structure with leadership crisis, we lost a whole lot of believers of the guild. So we're trying as much as possible to contain the guild within an atmosphere of, okay, we believe in our guild. And in that point, we cannot continue to begin to defend ourselves before social media people.
All right, thank you very much, Emeka Rollas. We have to end it at this point, but thank you very much for saying a lot and for honoring our invitation. Thank you very much for coming.
Thank you.